We are now going to transition to our panel, and I'll begin by introducing our panel moderator. Dr. Amina Sultana Haq is a family medicine physician, activist, and artist. She attended Jefferson Medical College, and during medical school, she was the founding chair of Functional, which stands for Free Universal Care in Our Nation, a universal healthcare advocacy organization. She completed a year of general residency training in New York prior to switching gears and joining family medicine. Her decision to switch was driven by a need to integrate a social justice mission with the practice of medicine. Dr. Haq completed her residency training in family medicine at Harbor UCLA Medical Center, a safety net county hospital in Los Angeles. She has also completed an MPH with a concentration in health policy, in particular, the Affordable Care Act at USC. Dr. Haq is now a full-time clinician at the Children's Clinic, a federally qualified health center in Long Beach. Most of her patients come from low-income and underprivileged backgrounds, and she has continued to pursue her interest in health policy on a local level.
All right. Hello, everyone. Thank you, all of you, for being here today, and I want to thank our panel for gracing us with their presence. So I wanted to start out with a definition, and I think we've been talking a lot about gentrification today, so I sort of wanted to bring it back in our panel. And gentrification has been generally understood to refer to the outward socioeconomic transformation of urban neighborhoods by income, housing, education, and occupational levels, traditionally discussed under the lens of sociology, urban planning, and geography, as opposed to sort of the health lens that we're talking about today. We are now understanding that there are real health impacts to this phenomenon. So I wanted to sort of open the discussion by speaking to Ms. Shaw here, who has lived experience of homelessness and has seen the effects of gentrification on a very personal level. Yeah. And I wanted to sort of have you elaborate on that and to speak to us about any insights that you have.
Yeah, so, I actually was permanently housed about a year and a half ago, and I, with my Section 8 voucher, and I can recall, walking around with my Section 8 voucher for approximately 9 months, trying to find some place. And within that 9 months, I had all these housing specialists with all these various programs, but no one was able to help me. And I literally saw one apartment within that 9-month period. And I can recall this dilapidated apartment in the Hollywood area, and this Rastafarian brother saying to me, what kind of money you working with? Because I can get like $5,000 from a vet. And I was on GR, $221 a month. What? And the area was completely not a comfortable area at all anyway. I can also recall talking to someone over the phone, a lady, and her broken dialect, she said to me, she said, are you Section 8 or are you normal? Yeah. And, I can remember sitting at a community meeting with a lot of executive directors and folks who run the missions and nonprofits in Skid Row, and around the same time, and having my Section 8 voucher with me, and some developers came in to give a presentation on a market rate unit that they were looking to bring in to Skid Row. And they were very intentional. And she gave her presentation about making these apartments available for people who work in downtown but can't afford the high-end lofts. So she was making very intentional about people who commute into downtown but can't afford the high-end trendy lofts. They then wanted to make apartments available to them in Skid Row. And she said, Giselle, so we know that we're going to have to talk to the people who move in, because there's quite a number of people who are living on the sidewalks outside here. And so we're going to have to talk to them so that they understand who the people are who are living around here. And we're going to have to, have several meetings on that. And we've already talked to LAPD about getting those people removed on the sidewalk out there, and we need your help. So just the fact that those people became criminalized just simply because they were displaced. And I'm sitting there furious. And I kept raising my hand, and she's like, "Wait your turn." And when she finally, I lit into her, and I said, "You need to understand that I was one of those people who commuted. I commuted in from Sacramento into San Francisco, Sacramento into Palo Alto, on and on and on a daily basis. I've gone through several displacements." I said, "Now I'm a middle-aged woman living in Skid Row, and I'm walking around here with a Section 8 voucher. And you're going to bring people into Skid Row where people are already unhoused? And you're going to make affordable housing market rate for other people by also telling them that, oh, those scary people out there on those sidewalks and in those streets." I said, when they need to understand that those scary people, this is their community. This is our community. And those people need to understand that they are coming into our community, and we are their neighbors, and they need to make room for us next door to them. Because it's like this, either you'll make room for us next door, or you can refuse to have us in your backyard, according to the NIMBYism. But one way or the other, we're going to be living next door to you, one way or the other, whether it's on the sidewalk or in an apartment. Yeah.
Okay.
Yeah.
Thank you so much for sharing. And so I wanted to go on from that and have each of the panelists reintroduce themselves and perhaps share a key point from what they spoke about today, or any key point that they'd like the audience to know.
Hi, everyone. My name is Sarah Jean Smith. I'm a recent alumni of UCLA. I graduated in June with my dual master's in public health and community health sciences and Latin American studies. I currently live in Reno, Nevada, and work for the University of Nevada, Reno as the coordinator of research and evaluation for the School of Social Work, Child Welfare. As far as the takeaway, I'm going to start by saying I'm certainly not an expert on gentrification. I have done a bit of work on it. And, I think I left us all this morning with some concrete steps that we can take as far as, thinking about what to take from this conference. I would say for me, again, the first one I really emphasized was listening to residents first and letting us be trained by them. Because I think that there's a tendency for those of us who are in public health as well as medicine, right, to think that we have a lot to teach the populations we work with. And I would say that my work in social justice over the last 17 years has taught me that I have a lot to learn from the communities I work with. So I'll leave it at that.
My name is Kartika Pallar. Can you hear me? No. Green light. It's on?
Should be on, yeah.
How about now?
Hold it. I think I can change the volume of the phone.
I see some nodding heads.
Yeah.
All right, I'll just keep talking. My name is Kartika Pallar. I'm at University of California at San Francisco in the Division of HIV, Infectious Disease, and Global Medicine. I'm an assistant professor there, and I gave a talk this morning about food insecurity and health and the role that housing insecurity may play. I think the take-home message is that food and housing are inextricably intertwined, that we have to address them in tandem, that together they are going to impact health, and that attempts to bring food into medicine, I think, are really important, but we can't ignore or forget the upstream determinants of things like food insecurity when we're addressing them for health. And
Exactly.
so that would be my message. And I actually would also love to echo what you said about bringing people whose lived experiences are at the center of this work into the process, I think is extremely important.
Hi, I'm Anastasia Lucairo-Sideris. I'm a professor of urban planning here at UCLA. As I was saying in my talk, we have started the anti-displacement project, which really seeks to document, understand, map displacement and gentrification in the region in Northern and Southern California, and also become a tool for action. And I want to say that actually following from your talk, which I very much enjoyed, that it is really society that needs to treat health I very much agree with that. And not only we need, all of us represent some kind of expertise, and it is really important to bring all this expertise on the table. But I actually, when you said that, I said, oops, that's what I wanted to say too. That basically who is often left outside of this discussion are the people that are the real experts of their lives and what's happening outside in their neighborhoods. And they're deemed invisible, or even worse, they are, the other population. And so finding ways to really empower their voices is extremely important. I mean, recently I was working with a team of students trying to help the mobility of lower income older adults in the inner city. And the surveys wouldn't work. So finally we said, well, let's go around the block and you tell us what you see and what you sense and what you're afraid of. And there was a wealth of information that came through their own voices, where we then had a much better understanding of, what are their fears. Some of that had to do with the apartment rent, even though they were living in an affordable, low-income senior housing. Some of them had to do with crossing the street and the light turning red. Some of it had to do with cracked sidewalks, going over rats on the sidewalk. I mean, these are things that your typical survey is not going to tell you. These are things that, as much as your expertise is, you are not really living this reality. So we really need to make these voices and these experiences visible if we really want to bring health into our communities. Thank you.
I think I just told you what to do. So maybe we could go on to the next question.
Okay. So also, you see two mics that are here on either side of the stage. So I encourage anyone in the audience who has a question to please come to the mic at any point, and we can call on you, and you can ask your question to any of the panelists, okay? So please feel free to do that. So I guess to start off, one question I had is, we've heard from a medical perspective, from a lived experience perspective, and from a community perspective regarding gentrification. What has been your engagement with people in the business community or in the political community about this issue? And I would invite all of you to speak around that.
You want to get started?
The business community?
Yeah, the business community or the or the political community. If you've spoken to politicians
I can respond that we have studied neighborhoods that gentrified versus neighborhoods that have not, trying to find which were very similar, like kind of running a natural experiment. And we found, as I was saying in my talk, that sometimes civic engagement, which was something that Clarence said, and community activism, and the number of community-based organizations that were active in the area had a major role. So we found there are a number of foundations in particular. I wouldn't say so much the corporate community, but there is the nonprofit community that are wonderful allies in this effort, and a number of grassroots groups, activists that are doing a very important role here in California. And so I think that that's where I found quite a lot of, hope and action, etc.
So I have done quite a bit of work with Downtown Women's Action Coalition, Downtown Women's Center, LA CAN, Los Angeles Community Action Network, Inner City Law Center, and Black Women for Wellness, California African American Women's Health Project, and others which have intertwined. I'm actually going to a social justice conference next weekend that intertwines with religion, religion and social justice. So there's different various intersections. All of these entities intertwine with the political world, and so we've fought back on issues in regards to people's right to rest, having their tents up during the day. I call them update Jim Crow ordinances like 5611, which impact people's a right to rest, penalizing and criminalizing and policing people simply because they have nowhere to go. In 2015, LAPD spent $100 million in the community of Skid Row, policing people, penalizing and criminalizing them because they had no place to go. Writing jaywalking tickets. You know, there's that whole thing of the light when it's green, and then when it would count down, they could, it's at their discretion in the past that they could ticket you as a jaywalking ticket as it started to count down. That law was actually just updated as of the 1st of this year, where you have to make it across the street, you know, as long as you're within the countdown, then you know you're not ticketed. But otherwise, you can be ticketed. So there's lots of pushbacks going on. I know that LA Can, you know, and through DWAC efforts, you know, we worked with the city councilman for District 14. Our community of Skid Row is Jose Huizar. There's a lot of ambivalence and love and everything at the same time as we work within these organizations and these city officials. But through the support of Councilman Huizar, we were able to get an ordinance passed where all the certified farmers markets now accept EBT so that people living in poverty have access to quality, fresh, produce and so forth. Okay. That's some things.
Go ahead.
I think it's very important to put gentrification in this long history of urban renewal, land shrinkage, disinvestment, and now gentrification. And it's a long political history. Part of the political history is that the real estate industry worked very hard to destroy government funding for low-income housing. Yeah. And this contributes fundamentally to people thinking public housing is a bad thing to have and to not having it maintained. So they really cut the legs out from under public assistance, saying that the market would supply housing. The market does not supply housing for low-income people. But the government's role in that was actively destroyed by the real estate industry. Urban renewal was a time when realtors and politicians got together in a kind of evil cabal to do these things, and that cabal has never been broken up. But there are always countervailing forces. So the more people can be organized, the more we can try to push in another direction. But it's hard to be organized if you're constantly being displaced. Mm-hmm. And it's hard to be organized if in the situation of wealth inequality, which means the politicians are more under control of the special interests, and developers, starting at the White House, have a lot of power a lot of political power in our nation. So we're in a very dire situation, so it's organization of people that's really got to push back.
I mean, you're absolutely right, and it's from day one, public housing was fought against. But I believe that the solution should come also from the government, in the sense that we have policies that we can push. I mean, there are policies for rent control and rent stabilization. It is a matter of political will, and it is a matter of pushing to get these. You can request housing units with every new development. You can have linkage fees. There are all these planning policies. Try to document them. Most of them not impactful because they're in the books, but they're not being implemented. But unless the public sector really takes the stance, the market is never, I fully agree, they're never going to do affordable housing because that's not where their profit rises. So it has to come from the municipal governments, it has to come from the regulatory section where you collect either in lieu of fees for affordable housing, or you have them create more units, you have tenant protection policies, you have to put rent stabilization policies. There are all these things. It's not rocket science. We have these policies, we have these tools. The problem is the political will.
Okay, Ms. Shaw.
I have to say something really important. Over a year ago and beyond, there was a huge push in the community of Skid Row for a Skid Row Neighborhood Council. And this draws contrast to all of this. So they actually, these political and city and developers, high-end developers, zillionaire, billionaire developers, were very much opposed to there being a Skid Row neighborhood council. Now you might want to ask, why would they fight poor people with nothing so hard for a Skid Row neighborhood council? It's all about the land. Now, I had been at those community meetings when elected officials and their supportive staff came and talked about, when we were going to do the election process and how there was going to be one voting place, and they were emphatic there would be no online voting, on and on and on. But these developers and these city people that work alongside them, they at the last minute somehow sued legally, created a legal ease window so that they were allowed to have online voting. So with this online voting, they had access but read out of databases of hundreds of constituents who supported their efforts. Now you have to remember, Skid Row, most of us have no computers. And so we had a short window within this day to vote at this one particular location. They had online voting with access to databases of hundreds. Subsequently, they ended up winning by approximately 68 votes or so. It's like some small number than that, was less than 100. But the reason why this is important, because some of these folks who supported them are sitting on city positions or within boards and committees who are also then behind, giving these high-end developers tax breaks and paving the way for them to be able to come in and build at their leisure, and giving them all these tax breaks and exempt along the way, while not really making them accountable for building building low income along with the market rate and above high-end lofts that they are building. I just want to say that.
Yeah. Thank you so much for sharing.
Yeah.
And again, I want to remind everyone, can you hear me? Yes, okay. Remind everyone that we have 2 mics on either side of the stage, so please come forth if you have questions, comments, anything that you'd like to share. Sorry, did someone else want to add to the discussion at this time?
I think there's someone there.
Okay, go ahead.
Really quick, I guess I usually try to be very intentional about things because I have my own perspective when it comes to the impact of gentrification, because it is class war, and it is an impact and cycle of violence of colonization. So with that comes guilt, and with that comes accountability. I would like to just tell people that there are things that people need to get involved in, not just kind of scroll through them online or Facebook, Instagram. There are actions that community members do, whether it's protesting a new art gallery that will commit and continue cycles of art washing, or whether it's using like development and these boho, SoCo, like little things. We need to be aware that it's okay to tell ourselves, like, maybe it's not a good idea to go to these places today, or we're not going to join our friends for a wine at this new bar. It's just about being mindful of the impact of that. And also that there is community land trusts, but people need to learn more about it, and there needs to be more push, as well as rent control. For me personally, it's very heavy, because I feel that it's also the white flight has an impact of how we've always just kind of like not talked about how there is discrimination when it comes to our race, when it comes to our class, when it comes to our gender. We need to be very conscious that there are triggers that we have carried, because it just genetically, we never really learned how to deal with this. So it's really hard sometimes for both ends. I think the people that are gentrifying and the people that are getting impacted by the gentrification, because nobody talked about this and how it's going to get resolved. But it goes back to community hands and letting it be grassrooted and not really getting it taken over by the nonprofits too. So my question to you all here is, how do you deal with the kind of work that you do when it comes to talking about gentrification, whether it's new or whether it's something you've been familiarized with? Because I suffer from a lot of anxiety from this, And it's nice to know what people could possibly do to alleviate the stress, and also what you would be planning to do to be conscious about not supporting gentrification, if you already do it or if you're planning to somehow, so people get an idea of how easy it is to support different sectors of community and also help our wellness. Thank you for letting me talk for a while.
Thanks. Thank you for sharing. Does anyone on the panel like to address that?
Well, okay, go ahead. I'm sorry.
I think it's a very difficult question, because one of the things about gentrification is its inexorability. Lots of communities have won fights in this process, but get wiped out over time. Gentrification doesn't happen. It's not a one-shot deal. And in the context of a housing famine, there's not enough housing. And so it's really important to think about this as not wealthier people and poorer people, but as a shortage of housing as part of society's infrastructure. And therefore, that it's the job of all of us to make it clear that everybody deserves a house and we have to provide housing, so that it's not just wealthier working people against poorer working people, but the whole working class together saying there's not enough housing for people who work for a living, period. But in this context of this inexorable process that happens in the presence of a housing famine, having kind of anxiety long term is really going to happen to people. A lot of people are at risk of homelessness over the long term, including many, as you're pointing out, who have decent jobs. A lot of people with decent jobs are going to be living 2 and 3 hours away from their work. Ridiculous situations. So the mental health stress is serious. It's going to get worse, and this is a long project. But if we keep in mind that this is a society-wide housing famine, we'll be in better shape. The National Low-Income Housing Coalition 2017 report said there is no county in the United States where a family making minimum wage can afford a 2-bedroom apartment. No county in the United States. There is no place to go. We have to turn this housing famine around. And part of that is about political will, but in a context of gerrymandering and lobbying by the wealthy and control of politicians by the wealthy, we are really in an uphill battle. So you've got to get very big picture here. The thing about getting very big picture is once you really understand your adversary, you can actually relax. You can figure out, okay, if I'm homeless, where am I going to crash? We're going to take each other in is what we're going to do. We're going to take care of each other. We're going to get through this. We have to build that kind of movement. And then we relax and go pick it.
Okay.
I just wanted to share that, in the last few years, I funded several kind of focus groups and spaces, creating spiritual space to talk about, how are we holding on to our wellness. And I did one with social justice activist women leaders, with Dr. Melina Abdullah with Black Lives Matter, and Becky Dennison, formerly of LA Can, and so forth, and others. And the focus was, how are we holding on to our beliefs in the middle of spiritual warfare? Because it all is centered around spiritual warfare. And so those are important conversations to have, because what I was also realizing, just as this young lady said, that as I'm out there on the front line, that as I'm out there, I come back to my private space, and you leave the front lines, and then you go back to what nobody talks about, healing, really, and how that really looks like and feels like. And you're right, it is very important, because anxiety and stress have a huge part, play a huge role in overall sustainability and equality. It has a huge lineage to the disparities and equities of people of color especially. And I even know, even for myself, I have learned to create boundaries in regards to even pushing back on some of the front lines that I go on today, and even in some of the rooms that I step in, because I know that I'm going to be triggered. And sometimes that even means in my own community, because I realized that, the anxiety and stress was playing a huge part of my cortisol and the weight gain that I was having, that ended up having me diagnosed obese and, borderline diabetic and all the other subsequent ills. So you're right. I mean, it's very important. I was having centers and creating spaces for women who are domestic violence survivors, because, we tend to, I remember I had one of my first case manager with the Department of Mental Health. She had a word when she gave me my first diagnosis, and it was labile, L-A-B-I-L-E, and I'd never seen that word before. And I remember I went up to the window, and this Black educated master's Ivy League sister says to me when I asked her what that word was, she says, basically, that you're a drama queen. Basically, that you're a drama queen. And it hit me hard. I didn't know what the word meant, but what I did tell me was that's how she saw me. So I later learned that word meant that, you go from one extreme to the other. Now that's trauma. So if you're really trying to help me as a medical mental health professional with a bedside manner, you're gonna say, you've been through a lot, and I wanna help you. I want to help you work through that. And lastly, I just want to share the story of, I have a medical doctor that I've had in Skid Row. I have a wonderful general practitioner now. But the doctor I had prior to her, a Polish male doctor, and I remember, people live in these lots. I mean, they work in these lots. People drive into Skid Row, and they oftentimes park in these underground parking lots, or these secured parking lots. And then in these underground parking lots, they take their elevators up to these trendy lofts, or they have vans that wait for them to drive them to these trendy buildings. And they sit in these air-conditioned office spaces where everybody looks, walks, and talks just like them. And they pat each other on the back all day long and say, boy, you're doing a great job. Aren't we doing a great job? But then at the same time, when a woman like myself leaves my dilapidated 100-year-old SRO in the heart of Skid Row with the drug dealers and the pimps and prostitutes and all the other ills all around, and I walk out and I've got to walk down this concrete jungle where men have a right to say any and everything they want to say to me and about me. And then I walk into a medical facility, and there's men who are there also stalking and listening and ear hustling, and they hear my name and all these things that are going on. By the time I get to that back office, hours later in front of that doctor, after sitting there for hours, and I'm all triggered and worked up, and he's now already heard about me being an ass out in the lobby. So when I get in his office and he says, why are you being such a bitch? He says to me in his broken Polish dialect, do you think I want him touching me? I don't want you touching me. I said, give me my pills and let me go. That's what I said. We have to be intentional. Thank you.
I have a few questions. Thank you very much. I appreciate your comments, and I have a couple of issues. I'm dealing with transitioning from being out on the streets. I'm a UCLA alumni. I'm working on my PhD, 30 years of professional experience, and due to family issues, found myself like you, and slowly transitioning. So one point, it's important, and I'm very glad we have someone representing your profession, the psychiatric end of things, because I transitioned. I rented a room in West Hills. It's important to look at the passive-aggressive things that are done to physically and psychologically injure people. I rented a room, and I had to leave and actually live out on the streets until I got help from my so-called caseworkers. I kept going back and forth to the ER because of their, I'll call it drug activity under the California marijuana laws. Now, I'll leave it at that, but I think that's something that's symptomatic of what I've studied in my PhD research. I've published books. I'm trying to be positive and proactive. These are on Amazon.com. Check them out. They're e-textbooks. Anyway, healthcare disparities. That's why I'm here, to get more data and meet and talk to more experts. But I was forced back out into the street, and I think there has to be solutions to keep that revolving, to slam that revolving door and find a permanent way of fixing it. The question I have, someone mentioned Medicare offers some housing solutions, and I'd like to hear a little bit more about that. I was working on a healthcare project in Woodland Hills and had more shocks because they have a policy that says they can cancel your insurance if there's so-called disruptive behavior. Now, we had a speaker just talk about those triggers. They can act, of course, one of their clients is in Ferguson, Missouri. It's a national health care provider. So they have a written policy that does something about so-called disruptive behavior. They also, I discovered, don't issue canes for the vision, people with vision challenges. And there's over 100 million in the database. So there's quite a few issues systematically, policy-wise. That's why I want to find out more about the Medicare housing aspect, Part C. But also I had another question, and that was, let's see. That's it for now. 2 questions. And check out the books, and please comment, review, give me ideas and suggestions, because I'm trying to solve this.
Thank you.
Instead of waiting.
Thank you. Anyone? I don't remember what the question is.
Oh, the other question, focus on senior citizens, because we're aging. As I mentioned, the database I dealt with has over 100 million members, and over 10,000 people a day are aging into the Medicare system. So it's something we're being faced with daily.
Well, I will say that, so I'm the only person with lived experience that I'm aware of that was appointed to the LACLC, Los Angeles Continuum of Care Board with LASA overseeing Measure H dollars, where for the next decade, or next 10 years, there's a quarter-cent tax that will go towards those resources in housing for people living in poverty, as well as homelessness. I also wanted to say that, you know, there are a lot of cultural competency ills, and the fact of the matter is the increasing population is single, women, elderly, middle-aged to elderly, Black, who are the #1 demographic, not just year after year, but decade after decade, who are living in poverty, who are living in homelessness. And then there's all these other ills which, you know, subsequently impact them. So one thing that I know as a LACLC board member, and the only one with lived experience, I called for our board to go through a cultural competency training, so then that we better understood as a board who the people we were called and appointed to, you know, to care for. And so, you know, and I'll just say that, you know, one person actually said, well, we can't save everyone. And I said, that's precisely why we have to have this cultural competency training, because we need to understand that we need to come from a sense of urgency, given the fact that LA only houses the highest homeless population in the United States of America. So we do need to come with a sense of urgency and intention on making sure that we are, you know, penetrating those dollars so they're getting directly to the needs of the people and those resources, rather than lining people's pockets, further poverty pimping, and keeping people oppressed while empowering those that, you know, how are basically running the system. So I'm with you, and I'm on you. I'm trust and believe. I'm working on it.
You can call me. I'm Phyllis Chastain. But the issue is about health care. As I told caseworkers, it costs 4 to 5 times more to go in and out of the ER than to be able to see your primary care physician that might be 50 miles away and that you can't get an appointment or get transportation to. Yeah, exactly. And then people are cited if they pass out on the street. Yeah. Yeah. So we can talk for days about that. Yeah. Any other comments about Medicare? And then
any other feedback from the panel? So I think we'll move to the...
Can I just say really quickly, though? So there's illegal dumping that's going on where actually, and there was something that happened, I think it was in Maryland with a Black woman, elderly Black woman during the holiday season, hospital dumping her out in the streets. So those are the issues that we continue to deal with that are very, very important. And I just want to say, you know, for myself, I remember when I was still in Yuma in 2005 and working at a very, very low wage retail job, and I was having trauma and kept ending up in the ER, and then I kept getting these bills, these really exorbitant medical bills. And somebody that I work with said, well, you know, you work here, you should be able to, and I kept going to the medical case manager at the hospital, and she says, you're not gonna qualify because you're single. So I was living in my mother's home, making $8 to $8.75 an hour. I couldn't afford to live out on my own. I had like $20,000+ worth of debt of my own, but because I was single with no dependents, they kept sending me letters back saying that I had an exorbitant income. I just want to say that.
And they discharge you at 1 a.m. and there's no bus until 5.
There you go.
Okay, we could talk forever.
All right, so we have a...
Sorry.
Thank you all for sharing. So we have a brief announcement. One of our panelists actually has to go and catch a plane.
Yes. So we just wanted to say thank you to Dr. Foylove one more time. She came all the way from New Jersey to join us this morning. And we'll resume the panel.
All right, so I want to go to our other mic, and gentleman in black, can you give your question?
Absolutely. First off, I want to thank you for this. Thank you for the space you've created. Thank you for the panel you've created. I can't tell you how many times I'm in a conversation about gentrification that is dominated by white men. Just uplifting the struggle, uplifting these voices, talking about the marginalized populations, the HIV population, the women, the specific effect of gentrification on women is much needed. It's a powerful voice. My name is Damian Gibbon. I'm on the front lines of gentrification. I'm the executive director of the Crenshaw Subway Coalition and the recently named project director of the AIDS Healthcare Foundation's Housing is a Human Rights Project. And, you know, AIDS Healthcare Foundation recognizes its mission is to provide cutting-edge medicine and advocacy regardless of a patient's ability to pay. And so we recognize the importance of advocacy in health outcomes, and we recognize the importance of seeing gentrification as a public health issue. I would say that it's an exception, though, not the rule. So my question, in this very powerful room that you've assembled, providing food for thought, food for belly, if the rooms that we are part of as we go downtown to talk to City Hall, we go to the state to talk about repealing Costa-Hawkins looked like this, I would imagine the decisions might be a little bit different.
Come on now.
So I'm asking the panel in this powerful room, after we've spent our Saturday morning and early afternoon here, what do you recommend that this room do as we come from here? And what are the next steps in ensuring that the medical community is a more powerful and heard voice in this gentrification issue?
Great question. I'll let you answer that.
Please, go ahead.
All right, I can start. You know, I gave the introductory presentation today, and I think I left us with a bit of a call to action, right? So after this, we're all going to return back to different communities, different organizations and institutions, and I think it really is up to us to think about how are we going to use the power and privilege we have in those spaces to really make sure that this is part of the conversation, and to think about the skills and the expertise that we have and really bring those to the table. So I offered a few examples this morning of what that looks like. The other thing to put out there is, you know, in public health, sometimes in medicine, though I would say less often, we talk about the social determinants of health, but we rarely ever talk about how we have to change the social conditions and therefore be committed to social justice work so that we live in a more healthy world. And so I think for us, the social determinants of health is political, right? And we have to be willing to make it political and to take a stand. And so I would also just put that out there on the table.
Thank you for sharing.
I would add probably a couple of words, just alliances and collaborations. I mean, kind of building networks horizontally, but also vertically. It is a wicked issue, a wicked problem. In many ways, the federal government has completely disinvested. It is the municipal governments that have to deal with that. And as someone mentioned after Prop 13, as a keynote speaker, the municipal governments are the weakest in terms of when it comes to monies. So, but then again, I mean, you have national politics. Nobody mentioned housing as, you know, the major issue. You know, there are all kinds of other important issues that are being discussed, but this has completely gone and pushed down to the municipalities. So I think I fully agree with you. It is a political issue. We really have to really bring back some of the higher powers into the conversation. So I think alliances, collaborations, we need a lot of, it's not a one-person struggle.
Well, speaking of collaborations, you know, I've intertwined and intersected with, in regards to homeless women, domestic violence, City Attorney's Office, Eve Sheedy is very intentional. There's Black women's entities in the community, California Black Women's Health Project, Black Women for Wellness, and others, positive movement with my friend who runs that. And just in regards to making sure that, you know, the intersection of domestic violence and women who are displaced, that's one of the huge demographic of why women are ending up displaced, and in the intersection with their children as well. The issue in regards to foster care individuals, people aging out of the foster care system. And so we have the two spectrums. We have really young, from foster care people ending up homeless, and to the middle-aged elderly who are ending up displaced. Lastly, I just want to say HIV, the intersection of HIV and domestic violence and sex trafficking and so forth. And I was at the Black Women for Wellness conference on HIV/AIDS and at Morehouse a few months ago. And, you know, one of the things is that even though it's mainly women of color, predominantly Black women again, living with HIV/AIDS, most of the dollars and resources still go towards white gay men. And only recently is one of these major entities actually who got involved with the HIV epidemic in the 80s. They're only now starting to be intentional as far as creating housing for people living with HIV/AIDS. So you have to hold people accountable as they continue to write their grants and get these hefty, all this money. What are they doing? You have to hold them accountable. You have to hold them accountable.
Thank you. All right, so we have a young lady at the mic.
Hi, so my question was actually what he asked, so thank you for answering that, but I also had a comment. So I work with a community organization called Promesa in Boyle Heights, and from my experience, I just want to say that they need you. They need everyone in this room, and they need everyone to take initiative because they're so full of work that they have to do on a daily basis that they wish they could do more, but we're talking like 1 or 2 people working in a certain problem in the community that they're overwhelmed, just like everyone else, maybe in other fields as well, including medicine, because one doctor can't save everyone, so it takes a team. So from my observations, there's a big gap between universities and communities, and we need to bridge that through initiative and not being scared of being rejected by communities. And with that said, in approaching communities, it's important not to take on the whole savior complex where I'm gonna save you and you should listen to me, because then that creates a bigger gap between communities and universities, and that's actually the problem that has existed. So I recommend that when people do reach out so that you can offer your help, but not to save somebody, right, but to see how you can learn from them. There's actually a quote, so I studied neuroscience here, but I was also a Chicano studies minor, and there was a quote that one of my professors put up that I was like, wow. So it goes, if you have come here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together. So remember that when you go into these communities and embrace that, because I think it will better make the relationships between universities and communities stronger, and that can help us help more people. So that was my comment. Thank you.
Yeah. Thank you so much for sharing.
If I could just quickly add on that, you know, I concur with that. People oftentimes come into Skid Row with the do-gooder complex. I'm going to come and save these Black people. Yet at the same time, you want to understand me from your perspective, from your background, as opposed to meeting me right where I am and understanding me and my journey. I know when I was like with the church and so forth, that women would come from the valley and they say, "Oh, Suzette, you know, you're so aggressive, you're so assertive." And I'm like, have you looked around you? I better be. You know, but there's been several dynamics of people not really understanding the whole of the person and what that whole of that person is living with. The fact that you get to get in a car and drive back into the valley where you live, I've got to walk back into the community to my apartment. So just understand the dynamics, yeah.
Thank you for sharing. All right, so we have a young man at the mic.
Well, I figure I'm so loud I figure I'm so loud I don't need the mic. Sorry. My name's Joey. I'm an UCLA alum. Now working in SEML, like in the field of autism. Oh yeah, like quick comment as quick as possible. Like I'm interested in like autism and like it's like interested in issues of like intersectionality and like autism with like race and like class, gender, and like all sorts of other factors as much as I can. Well, and I want to address intersectionality like more adequately in autism over time. I'm wondering, like, how do we? This is probably a super big question, but like, how do we reverse the process of gentrification and its interdependent effects of like bad health and like other issues?
Anyone on the panel?
No, I think I have an answer for that.
Okay. All right.
I wanted to
Please
just chime in on the what to do or just some further thoughts because I really agreed with all of my colleagues here. Collaboration, building bridges, being held accountable as somebody in the university. And I just wanted to say that from the standpoint of being in academic research working on these issues, the tendency always in academia is to become siloed into an issue, into your specialty, into your expertise. And that, you know, that has a purpose in one way, but it's really important if we want to actually see our work out in the world that we find ways to break out of that. And break out of that across disciplines, but also break out of that by building relationships with the community, with organizations, with people, on an equal basis, right? And I hope that all of my colleagues here who are kind of in a similar position are already doing that or will continue to. I know I will strive to continue to do that as well, but I think that's very important. And I wanted to make one last comment actually about accountability. You know, the whole way that the HIV, the history of HIV and what happened from the beginning of the epidemic until now was really driven by a movement of the people who were living with HIV and affected to hold the medical community and the research community accountable to doing work that was going to actually improve their health and not kind of meet their own agenda. And so I think it can be a model moving forward.
I just want to say quickly that in one way of addressing systemic issues of racism and oppression is perfect example is the pathologizing that goes on from one culture to another. Say, for instance, like with the crack epidemic in the 80s and so forth, and where they saw like the cradle to grave, where they would see that one black baby stood a chance, one black baby out of 5, one black male baby out of 5 had a chance in society when the rest would end up going through the system. Now, here we are today in regards to the opioid epidemic. And so when we see the opioid epidemic as a state of emergency, and we've got to help in these white middle class, communities and families of people dying, and yes, there is a concern, but just the pathologizing in the crack epidemic of black families, it was we got to penalize, criminalize police, put them in jail and kill them. We're going to separate black families. Those damn niggas, they out there doing that crack cocaine, and we've got to take care of that problem. We got to police them. So then, hence, ends up how you end up in a community such as Skid Row, which houses all these mainly black folks, again, middle-aged and elderly, who probably, left over from all of those other years, and where we're still looking at pathologizing who they are as a people rather than seeing them as people. We dehumanize where we want to dehumanize, and we humanize where we want to humanize. So that pathology has to change. That the pathology has to change, because that is the dynamic that continues to perpetuate the systemic racism and oppression that happens every single day within the medical field and all of the other intersections. Thank you.
Okay. Thank you so much.
Can I say one? Real quickly. So just really quickly. And the perfect example of this is also I don't know if you're aware of the Grim Sleeper murder case, but 100 black women were raped, tortured, and murdered in South Central LA over 2 decades. The system labeled them NHI, no human involved. Now that was a label within the system simply because these women were black, living in poor communities, and some of them were women of the night. They were labeled NHI. They weren't even seen as human. So they weren't even calculating into these communities, and where there was actually addressing the fact of, well, we've got a serial killer going on. So because they weren't even calculating that there was a serial killer, because these women didn't matter, they were throwaways, then that's how the situation was able to perpetuate, and these women not just for over 2 decades, continued to be raped, tortured, and murdered. I was at the sentencing hearing. I listened to some of these women tell their stories, and family members, and I was part of the Black Coalition. But NHI, no human involved. And I dare to say today that is exactly what goes on with the black women living in Skid Row. No human involved. That's all.
Okay. Thank you.
Thank you
for sharing. So I just wanted to end our panel discussion with each of our panelists sharing a take-home message as well as an action item, if you will. You go ahead and start.
I feel like I've shared both.
Okay.
I can't think of any additional ones.
Okay, no worries.
Similarly, I think I left you guys with some homework, so I think I'm good.
And Michelle, I need to.
Yeah. So I would encourage you, as Trishawn Carey, to pick up the baton. I would also encourage and introduce, I call it the Howard Griffith effect, and that's been one of my situations. I don't know my place. I feel like my place is with y'all as much as it is in there in Skid Row. So, but that actually ends up making people uncomfortable. So I'm one of those people, I'm gonna come into the room. A lot of social justice activists, they're not willing to come into the room and be at the table with policy people. But I'm gonna be at the table, I'm gonna sit at the table with you, and I'm going to let you hear the really uncomfortable and the raw and the ugly, the not so pretty. I used to, at one point in my time, consider myself privileged. I had my own office and name plaque on my door. I now consider myself free and call my office the streets. That's all. Yeah.
Thank you. All right.